All right, finally going to talk, or what we're going to talk about vitamins, in particular fat-soluble vitamins. There are two types of vitamins. There's water-soluble, which you cannot overdose on. A lot of people, always ask, can you overdose on vitamins? Well, yes and no. If you take the water-soluble ones, no. Like vitamin C, um, there's a whole bunch of other ones you can't really overdose on. However, fat-soluble vitamins, overdosing, yeah, I mean, you could. We're probably talking about very large amounts of it. But the fat soluble vitamins you should take within the required amount because they do get stored inside the body. The polar ones kind of go out in your urine. Okay, so they usually require a very small quantity for normal metabolism and must be obtained from your diet. So again, there are two types: water soluble and fat soluble. The four fat soluble: A, D, E, and K. All right, these are the most common ones and the ones that we need quite a bit. They come from fruits and vegetables, fish, liver, dairy products. They are stored in adipose cells and can be used when they are needed. All right, so vitamin A is a big one. This is kind of used for our sight, our vision. It's found also in it's actually known as, well, actually, if you take vitamin A, you can synthesize it into beta carotene. Um, and Hold on one second. And beta carotene is actually, or vitamin A is used in our vision, and beta carotene is in obviously a lot of vegetables, like carrots. And if you eat a lot of beta carotene, and if you slice the molecule in half, you get vitamin A. So what a beta carotene is two vitamin A molecules hooked altogether. So it's twice the size of this. So imagine this group attached onto this side as well. All right. It's needed for vision and for healthy mucous membranes. Vitamin A deficiency causes night blindness, dry eyes, and skin. Vitamin D is actually used in the synthesis of cholesterol. If you look at this molecule, can you kind of see the cholesterol? All right, notice 1, 2, 3, 4, 5. Remember that cholesterol is a 6, 6, 6, 5 ring system. Here's one carbon. If you hook these like together, you have another 6 carbon ring. All right, actually, I believe if you take it and wrap it around over here and hook onto it, 1, 2, 3, 4, 5, 6. Here's another 6. Here's another 5. So vitamin D is actually, it's needed to make cholesterol inside of our bodies. All right, it can be attained from many foods, milk. It also helps regulate calcium, potassium. Um, Rickets. I honestly don't know a single person that has ever had rickets these days. Vitamin C is kind of, I'm sorry, I think rickets is pretty much obsolete. Um, in a modern world, it could probably happen more if they don't have enough food in other countries, but you never really hear about rickets these days. Vitamin E is an antioxidant, all right, protecting unsaturated side chains in fatty acids from unwanted oxidation. Um, Anytime you have an oxygen or a double bond of some sort, you can get oxidized molecules. So vitamin E kind of stops that. Um, let's see, with this one, a deficiency of vitamin E causes numerous neurological problems, although it is rare. All right. Vitamin K regulates the synthesis of blood clotting proteins, and a deficiency in this leads to excessive and fatal bleeding. So vitamin K, yes, is very important. Um, I know in hospitals when they circumcise boys, they give them quite a bit of vitamin K right before they do it. And this is the reason why, so that they don't have excessive bleeding from the circumcision. And I want to say, I don't know if they orally give it to the babies or if it's like a cream or something. I can't remember offhand. But I know that that they do this. Also, I believe in babies that the vitamin K in their bloodstream spikes at like the 8th to 12th day of them like being born. So usually a lot of these circumcisions are done around then, about like 2 weeks after that the baby is born. So I have 2 boys. That's kind of why I know all that. All right. Um, let's see. Prostaglandins, leukotrienes. Um, so this is another type of fats inside our bodies, from the prostaglandins and leukotrienes. These are compounds which are not stored in cells, rather synthesized in a response. Unlike hormones, they are local mediators performing their function in the environment in which they are synthesized. So here's example of, so again, a prostaglandin has this kind of shape to it. It has a 5-membered ring with 4 groups hanging off of it, and usually these groups are the same. You have a long chain here, and you either have like 2 oxygen groups here. You can also see here we have them too. Um, Prostaglandins are responsible for inflammatory responses. Aspirin and ibuprofen relieve pain and inflammation by blocking the synthesis of prostaglandins. Prostaglandins also decrease our gastric secretions, inhibit blood platelet aggregation, stimulate uterine contractions, and relax smooth muscles. Does quite a bit. There are 2 different cyclooxygenase enzymes responsible for prostaglandin synthesis, and they are all the COX-1 and 2. COX-1 is involved in the usual production of prostaglandins. COX-2 is responsible for additional prostaglandins in inflammatory diseases like arthritis. A lot of drugs block these, I believe, for anti-arthritis medications. Yeah, also like the non-steroidal anti-inflammatory drugs like Advil and aspirin and things like that. They inactivate both of the COX-1 and 2, and increase. And this is one of the reasons why it increases the risk of an ulcer. If you know anyone that takes a lot of ibuprofen, you kind of have to stop it if you start getting an ulcer, because you are prohibiting the production of like the mucus lining inside of your stomach. All right, Vioxx, all right, is a common drug. Blocks only the COX-2 enzyme without affecting our gastric secretions. All right, asthma is characterized by a chronic inflammation in the lining of our lungs. So inhaled steroids reduce the inflammation. Leukotrienes are molecules that contribute to asthmatic response by constricting smooth muscle in the lung. So new asthma drugs are blocking the synthesis of leukotrienes, which treat the disease instead of just the inflammation symptoms. All right, so there is quite a lot in this chapter. Do the homework problems. I kind of give you more of an idea of what I want you to know in the homework problems. I know a lot of you are in the health professional. A lot of you might already know this, but for someone who's going in the health field, a lot of this stuff is kind of interesting to actually know. Depending on which area that you go into. But obviously, I'm not going to, I'm not going to test you on these drugs. But kind of understanding what our bodies do and how drugs are all developed in inhibiting a certain response inside of our body is kind of important to actually know. Okay, so obviously we will talk more about this in class and bring your questions.